I had painful periods. I had a laparoscopy, a depot shot, and everything the GP could provide. But these past 2 months, I'm having heavy flow, changing my pad every hour. After the laparoscopy, they said everything was normal. Now I don't know what to do. Nothing seems to work for me. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Welcome to another health education video. Abnormal uterine bleeding is when a woman has vaginal bleeding outside of a regular menstrual pattern. Years ago, we referred to any irregular menstrual bleeding outside of abnormal organs, pregnancy, or any general chronic illness as DUB, that is dysfunctional uterine bleeding. Then we didn't realize all the other issues women could have that could lead to irregular menstrual bleeding. We know better now, and most doctors no longer use that term dysfunctional uterine bleeding. Instead, we prefer abnormal uterine bleeding to explain any type of bleeding that is outside of the regular menstrual pattern, whatever the cause. What does abnormal uterine bleeding look like? The main aspects of a woman's period affected in abnormal uterine bleeding is the pattern of the bleeding and the volume of blood that she's losing. So here are some terms that we would use to characterize a lady who has abnormal uterine bleeding. Unpredictable bleeding. It could be heavy, but it could also be scanty, spotting, or slight bleeding. Frequent periods, random, prolonged menstrual bleeding. An irregular period profile, which refers to a woman who does not have a regular bleed at a scheduled or predictable date month after month. We can also add to heavy bleeding, painful bleeding cramps that are distressing or make it difficult for a woman to carry out simple activities of daily living. Nearly every woman will have abnormal uterine bleeding at some point in her life. For quite a lot of them, it can be incredibly distressing or at the very least frustrating. Women can feel incredibly anxious about being unable to predict when the next period will come or unable to function from very heavy painful periods. Let's look at the types of abnormal uterine bleeding. Abnormal uterine bleeding can happen whether a woman is ovulating or not. We've learned that most cases of abnormal uterine bleeding happen when a woman is not ovulating. This is also known as anovulation. Most of the time it happens early in puberty or around the time when menopause is about to start, that is the perimenopause. During either of these times, girls and women can have period delays. When they eventually bleed, the period is heavier and often longer than usual. But why does it even happen? Here is a reason. If a woman is not able to ovulate properly, that is, develop and release a mature egg, she can't make enough of the hormone progesterone. As a result of this hormone imbalance, there is continuous excess production of the other hormone, estrogen. This will affect the womb, making the womb lining overgrow and lead to abnormal or irregular bleeding. Another way anovulation and hormone imbalance can contribute to abnormal uterine bleeding is when the reproductive organs are still immature, and that is pretty common in many teenage girls. Now, what about when a woman is ovulating? Well, you can also get hormone imbalances when you're ovulating. Some of these ladies have low estrogen levels, which leads to prolonged progesterone exposure. Unfortunately, this will also affect the womb lining, leading to irregular bleeding. Now, if a woman has abnormal uterine bleeding and you want to tell from her periods whether she is ovulating or not ovulating, here are some tips. Often, women with anovulatory cycles, that is, who are not ovulating, have irregular or infrequent periods with flow that ranges from being very light or scanty to excessively heavy. On the other hand, a lady with abnormal uterine bleeding who is ovulating will have periods that happen at regular intervals but with a heavy and prolonged duration. These ladies may also have premenstrual symptoms, so feelings of fullness, bloating, cramps, breast tenderness or soreness can indicate that a period is about to start. So looking at your period pattern can help you or your doctor work out whether or not you're ovulating. However, blood tests for progesterone usually confirm what the situation is. So we've seen that in many women, abnormal uterine bleeding can arise from hormone imbalance, but there are several other causes that can result in irregular periods. For example, fibroids, polycystic ovarian syndrome, sexually transmitted infections, womb cancer, stress, certain medications like birth control pills or other birth control methods, excessive weight loss, being overweight, endometrial hyperplasia. That's the word that we use to refer to when the womb lining is thicker than a normal range, thyroid disease, and a host of other different conditions that can cause irregular menstrual bleeding. But let's look at how the doctor can diagnose and eventually treat different cases of abnormal uterine bleeding. We appreciate that there are different causes, but how do we detect which one is responsible in different women? We will start with a full assessment, and that includes getting details of your symptoms and how they've evolved, your early menstrual periods, your period pattern, any other medical conditions that you might have, any treatments that you've used or you're currently using. Everything about your medical background that can give us some idea about what's causing the problem. There could also be a physical evaluation, a physical examination. Next, you will have tests which will include blood work, for example, your hormone profile, that can help us check for conditions like polycystic ovary syndrome, thyroid disease, and whether you are anemic, especially if you've had heavy bleeding. Other tests include an ultrasound scan of the pelvis and the abdomen that will demonstrate if there are fibroids or cysts, ovarian cysts, for example. Still more tests include examining the womb lining using a little camera that goes into the womb and taking a biopsy to study the tissues of the womb even more closely. You could also have a laparoscopy, which is when a little camera is introduced through the abdomen to have a look at the pelvic organs, and tests that you've had recently like a cervical smear will also be useful in your evaluation. What about treatment for abnormal uterine bleeding? Of course, this will depend on the cause, and options will include medication and surgery. But lifestyle approaches to treat things like stress, weight problems will also play a very important role. We use hormones like the birth control pill to suppress abnormal changes in the womb and offer relief from heavy flow of the periods. For some, especially after completing their families, surgery is an option. An example is a hysterectomy, the removal of the womb, after which the woman will no longer suffer from any periods at all. Another surgery alternative is endometrial ablation, where treatment is directed at the lining of the womb to destroy it, leading to no periods, or in some cases very light or scanty periods. For a woman having such treatment, it must be clear that she no longer intends to have any children, because the likelihood of pregnancy after endometrial ablation is of course very, very slim. So let's look at the example this video started with. It's important to look at hormone imbalance as well as several other causes that may be responsible for this lady's problem. We will be thinking, how old is she? Is she perimenopausal? What treatment will be acceptable to her depending on which stage of life she is? For example, has she done bearing her kids? In that case, surgery may be more acceptable to her and provide lasting relief. These and more are discussion points that she needs to have with her own doctor to work out the best solution to give this lady relief from this distress that she's going through. Earlier in this video, I talked about how birth control drugs and methods can affect your period. So please drop me a comment about your experience with abnormal uterine bleeding. Then head over to this video where I talk about the bleeding effects of birth control methods.